Frequent urination in seniors isn't always a sign of drinking too much water. It's often a sign your body is trying to tell you something else, says Dr. Neil Baum, a prominent American urologist and professor at Tulane University School of Medicine. Let that sink in for a moment. You didn't drink more water today, maybe even less than usual, yet you've already been to the bathroom multiple times. You might be wondering, what's going on with my bladder? Why am I urinating so often when I've barely had anything to drink? It's a question that frustrates millions of seniors every single day, especially when those nighttime trips to the bathroom start interrupting precious sleep. Here's the truth. Your frequent urination may have little or nothing to do with your fluid intake. In fact, the real culprits are often hidden in your medications, your diet, hormonal changes, or even how your kidneys and bladder function as you age. And ignoring it, or chalking it up to just getting older, can sometimes mean missing early signs of more serious issues like diabetes, prostate problems, or bladder dysfunction. In this video, we're pulling back the curtain on the real reasons seniors pee more often without drinking more water. We'll talk about how your bladder changes with age, the surprising foods that irritate it, and simple, natural strategies to help you regain control and sleep through the night again. So, if you're tired of the endless trips to the bathroom, or worried about what your body might be trying to tell you, stick with us. And don't forget to like, subscribe, and share this video with someone you care about. Because bladder health is more than just an inconvenience, it's a window into your overall well-being. Common medical reasons behind frequent urination. If you're drinking the same amount, or even less, but still running to the bathroom more often, it's time to look deeper. Frequent urination in seniors is often linked to a range of medical conditions that have nothing to do with hydration. In fact, these conditions can silently develop over time and only reveal themselves through changes in your urinary habits. Let's start with overactive bladder, OAB, a condition that affects millions of older adults. It's characterized by sudden urges to urinate, frequent trips to the bathroom, and sometimes even involuntary leakage. OAB doesn't mean your bladder is full. It means your bladder muscles are contracting too often, sending urgent signals to your brain even when there's little urine present. This is one of the most common yet underdiagnosed causes of frequent urination among seniors. Next, for men, an enlarged prostate, or benign prostatic hyperplasia, BPH, can be a major culprit. As the prostate gland grows larger, it puts pressure on the urethra, which can block urine flow and prevent the bladder from emptying completely. The result? You end up feeling like you constantly have to go, because your bladder never fully empties. And unfortunately, many men ignore these signs until it severely disrupts their sleep or daily life. For both men and women, urinary tract infections, UTIs, can trigger frequent urination, even if you're not drinking much. In older adults, UTIs don't always cause the classic burning sensation. Instead, they can simply cause increased urgency, cloudy urine, and discomfort in the lower abdomen. Postmenopausal women are especially at risk, due to hormonal changes that affect the urinary tract's natural defenses. Another important but often overlooked cause is diabetes or prediabetes. When blood sugar levels rise above normal, the body tries to flush out the excess glucose through urine. This not only increases urination but also leaves you feeling dehydrated, thirsty, and sometimes dizzy or fatigued. Frequent urination, especially when paired with increased thirst, can be an early warning sign of diabetes that should never be ignored. Finally, don't overlook your medications. Many common prescriptions taken by seniors, including diuretics, often called water pills, blood pressure medications, and even some antidepressants, can increase urine output. Diuretics are designed to help your body eliminate excess fluid, but they can also cause you to urinate more frequently, especially if taken later in the day. If you've recently started a new medication and noticed a change in your bathroom habits, it's worth talking to your doctor. In short, frequent urination in seniors is often the result of medical conditions that deserve attention, not something you should ignore or simply blame on getting older. Whether it's an overactive bladder, prostate issues, a hidden infection, elevated blood sugar, or a medication side effect, your body is sending you a message. And identifying the real cause is the first step toward relief. Now that we've explored medical causes, let's talk about something just as important, but often completely overlooked: your diet. That's right. Even if you're not drinking more water, the foods and beverages you consume each day can have a powerful effect on your bladder and your body's fluid balance. Let's start with caffeine. Many seniors enjoy their daily cup, or 3, of coffee or tea. But caffeine is a well-known bladder stimulant and mild diuretic. It increases bladder activity and can create a sudden urge to urinate, even if your bladder isn't full. And it's not just in coffee. Caffeine hides in tea, soda, chocolate, and even some over-the-counter medications. Surprisingly, even decaffeinated coffee and tea still contain small amounts of caffeine, just enough to irritate a sensitive bladder. Next, consider alcohol. Whether it's a glass of wine with dinner or a nightcap before bed, alcohol acts as a diuretic and also interferes with the hormone that helps your kidneys retain fluid. This means you end up producing more urine, often at the worst possible time, like the middle of the night. Even moderate alcohol intake can cause seniors to wake up multiple times to use the bathroom, disrupting sleep and overall well-being. Another hidden trigger: acidic and spicy foods. Citrus fruits like oranges, grapefruits, lemons, and even tomatoes can irritate the lining of the bladder, increasing urgency and frequency. Similarly, spicy foods with ingredients like chili, hot sauce, or vinegar can worsen bladder sensitivity and trigger unexpected trips to the toilet. And don't overlook artificial sweeteners. Found in sugar-free gum, diet sodas, protein bars, and diabetic-friendly products, sweeteners like aspartame, saccharin, and sucralose have been shown to stimulate the bladder in some individuals. Many seniors turn to these products to reduce sugar intake, but unknowingly increase their bathroom visits in the process. If you're peeing frequently without increasing your water intake, it might not be your fluids at all. It might be the ingredients you're putting into your body. Keeping a simple food and bladder journal can help you identify patterns and pinpoint which foods might be causing problems. Neurological or hormonal factors. Frequent urination in seniors doesn't always start in the bladder. It can actually start in the brain or hormone system. That's because urination is controlled by a complex network of nerves, hormones, and muscles that all have to work together. And as we age, that system doesn't always function the way it used to. Let's start with the nervous system. In healthy adults, the brain and spinal cord send signals to the bladder to let it know when to store urine and when to release it. But if these signals are disrupted by aging, injury, or neurological disease, the bladder may start acting on its own. Seniors with conditions like Parkinson's disease, multiple sclerosis, or Alzheimer's disease often experience bladder dysfunction, including urgency, frequency, and even incontinence. Even without a diagnosed condition, natural age-related nerve decline can reduce the brain's control over the bladder. Hormones also play a surprisingly large role. For women, the decline in estrogen levels after menopause can weaken the muscles around the bladder and urethra, making it harder to hold urine and easier to feel the urge more often. In men, changes in testosterone can also impact bladder control and prostate function. Hormonal imbalances don't just affect mood or energy, they directly affect urinary patterns too. Additionally, circadian rhythm disruptions, which are more common in older adults, can throw off the body's fluid regulation. Your body may produce more urine at night instead of during the day, contributing to nocturia, or nighttime urination. This explains why many seniors feel fine during the day but are up multiple times during the night. If your nervous system or hormones are out of sync, your bladder will be too, and no amount of water restriction can fix that. Why you pee so much at night? One of the most frustrating aspects of frequent urination for seniors is waking up multiple times at night to use the bathroom, a condition known as nocturia. For many, it disrupts sleep, drains energy, and affects mental clarity the next day. And yet, the amount of water consumed often hasn't changed. So, why does this happen at night? As we age, the body's internal systems that regulate urine production begin to shift. Normally, the kidneys slow down urine production during sleep to allow for uninterrupted rest. But in older adults, this nighttime suppression weakens. As a result, your kidneys may continue producing urine at the same rate, or even more, during the night than they do during the day. This leads to more frequent awakenings and bathroom trips that can drastically lower sleep quality. Another key factor is fluid redistribution. When you lie down at night, Fluid that has pooled in your legs and lower body throughout the day returns to your bloodstream. Your kidneys detect this increase in circulating fluid and respond by producing more urine. This explains why some people can go for hours without peeing during the day, but then find themselves up 2 or 3 times overnight. Nocturia can also be a sign of underlying health conditions, like congestive heart failure, where excess fluid builds up in the body. Additionally, sleep apnea, a condition where breathing repeatedly stops and starts during sleep, has been shown to increase nighttime urine production due to hormone imbalances triggered by low oxygen levels. And if you're taking diuretics, water pills, for high blood pressure or heart conditions too close to bedtime, you're likely setting yourself up for multiple bathroom visits during the night. Ultimately, nocturia isn't just a bladder problem. It's a whole body issue involving the kidneys, heart, sleep cycles, and even posture. Identifying and addressing the root cause is essential, not just to reduce those nightly trips to the bathroom, but to restore your sleep, energy, and overall well-being. What you can do about it. If you're frustrated by constant urination, especially when you haven't been drinking more water, don't worry. There are practical steps you can take to gain control. Whether your bladder issues stem from age-related changes, diet, medications, or medical conditions, the right strategies can make a significant difference in your daily life. Let's begin with bladder training. This simple yet powerful technique involves gradually increasing the time between bathroom visits to retrain your bladder and reduce urgency. Start by holding off urination for just 5 to 10 minutes when you feel the urge. Over time, increase the intervals. This helps stretch the bladder and reduce its hypersensitivity. Combine this with pelvic floor exercises, commonly known as Kegels, which strengthen the muscles that support bladder control. These exercises are especially helpful for women after menopause and for men recovering from prostate treatments. Next, consider making dietary adjustments. Avoid bladder irritants like caffeine, alcohol, carbonated drinks, citrus, tomatoes, spicy foods, and artificial sweeteners. Pay attention to how certain foods affect your urination patterns. Also, increase your fiber intake, as constipation can worsen bladder pressure and make urgency worse. And remember, not drinking enough water can actually make things worse by causing concentrated urine, which irritates the bladder lining. Now let's talk about timing. Managing when you drink fluids is just as important as how much you drink. Avoid drinking large amounts within 2 hours of bedtime to reduce nighttime trips. If you take diuretics, ask your doctor if you can shift the timing to earlier in the day. For many seniors, it's also helpful to elevate the legs in the evening. This helps fluid that's pooled in your lower body move back into circulation before bed, so your kidneys process it while you're still awake. Simply resting with your legs elevated for 30 to 60 minutes before bedtime can reduce nighttime urination. If you're looking into natural remedies, several herbal supplements may help. For men with enlarged prostates, saw palmetto or pumpkin seed extract may relieve symptoms. For general bladder support, corn silk tea, horsetail, and magnesium supplements have shown promise. But remember, always check with your doctor before starting any supplement, especially if you're on other medications. Lastly, don't skip medical care. Frequent urination may seem like a nuisance, but it can be a symptom of something more serious, like diabetes, kidney dysfunction, or prostate problems. A simple urine test, bladder scan, or blood sugar check can provide clarity and peace of mind. The most important takeaway. You don't have to accept frequent urination as an inevitable part of aging. With the right knowledge and lifestyle changes, you can reduce urgency, sleep better, and take back control of your life, one step at a time. When to see a doctor. While some causes of frequent urination can be managed at home with diet and lifestyle changes, it's important to know when it's time to involve your doctor. Urinating more often, especially without drinking more, can sometimes be your body's way of signaling that something more serious is going on. If you notice sudden changes in your urination patterns, pain or burning while urinating, blood in the urine, or unexplained weight loss or fatigue, don't wait. These could be signs of a urinary tract infection, diabetes, kidney problems, or even bladder or prostate cancer. Also, if you're getting up more than 2 times a night to urinate, it's worth having a conversation with your physician, even if there's no pain. Another red flag is urinary incontinence, especially if it's new or worsening. Leakage, dribbling, or the feeling of not being able to hold it could indicate an overactive bladder, nerve dysfunction, or prostate-related issues in men. Many seniors simply assume these symptoms are just aging, but that mindset can delay important diagnoses. A urologist, geriatrician, or primary care provider can help identify the root cause and offer treatments that restore comfort and quality of life. The misconception about water intake. One of the most common assumptions people make, especially seniors, is that frequent urination must mean they're simply drinking too much water. Seems logical, right? More in equals more out. So many older adults respond by cutting back on fluids, thinking this will solve the problem. But here's the surprising truth. In many cases, the problem isn't about drinking too much. It's that your body isn't managing fluids the same way it used to. As we age, several important systems in the body, especially the kidneys and the bladder, don't function as efficiently. The kidneys may filter blood more slowly or less effectively, and the bladder's ability to store urine can decrease. Even the sensation of bladder fullness becomes more sensitive, triggering the urge to urinate earlier than it should. All of this means you can end up urinating more often, even when your fluid intake stays the same or even decreases. Dr. Reena Malik, a leading urologist and pelvic surgeon, often emphasizes that reduced bladder capacity, changes in hormonal signals, and age-related weakening of pelvic floor muscles all play a role. So blaming water alone is not only misleading, it can actually make things worse. Dehydration can lead to concentrated urine, which irritates the bladder lining and increases the urge to go. It can also raise your risk for urinary tract infections and kidney stones. The bottom line? It's not just about how much you're drinking, it's about how your body is processing and responding to fluids now that you're older. If this video helped you better understand what's really going on with your bladder, give it a thumbs up and share it with a friend or family member who might be struggling with the same issue. Don't forget to subscribe and click the notification bell so you never miss our senior health tips. And we'd love to hear from you. Comment below and tell us, which of today's facts surprised you the most? And if you think frequent urination is frustrating, wait until you hear about the healthy fruits that may be silently irritating your bladder. Click on our next video right here to find out which ones to avoid.